See the little bit? Almost. No?
Welcome back, everyone. I'm Dr. Khan.
And I'm Dr. Sherry Kokendorfer.
And we're both physicians and co-owners here at Mosaic Theory MD, a direct primary care practice.
So what is direct primary care?
Direct primary care is just that, a direct relationship between a patient and a doctor.
So wait. I don't have to talk to 10 different people before I talk to you about my problem?
Exactly. Imagine unlimited visits with a doctor. Imagine having minimal to no wait times to be able to make an appointment to see us. Imagine when you get here that you have minimal to no wait times in the waiting room. Imagine your visits being 30 minutes to an hour long rather than the high and by 5 minutes that you usually get in the traditional system. Imagine having my phone number, my email address, so that after hours or on the weekends, rather than worrying about urgent care visits or ER visits that are expensive and time consuming, you can just pull out your phone, text me or call me and figure out your problem, and with a physician who knows you and has and understands your background, and rather than when things come up having to resort to Google MD, right? Well, that is what direct primary care is, and that is what we do here at Mosaic Theory MD.
This just all seems too good to be true. Like pie in the sky, kind of dreaming. If it's a perfect world, I'd have the doc in my pocket, right?
But I am the doc in the pocket, and direct primary care allows us to do that.
How do you do that?
We are doing this by removing barriers to care. This means we don't actually worry about billing insurance here at all. Whether you have health insurance or not, it really doesn't matter. The direct primary care model is actually a membership-based model, and that might make you think, oh my gosh, that must mean that we're super expensive. On the contrary, actually, we're quite affordable. And $109 a month, we're able to provide unlimited direct access to our patients. In that monthly fee, we're able to do all of what I just described. And on top of that, we're able to extend wholesale costs for labs, imaging, and prescriptions because we're able to reach out to the vendors directly and negotiate prices for our patients. So think of it as like a Costco for medical care.
Yeah, this sounds fantastic. And how many of you have been through this? I know I have, even as a physician, waiting of trying to get a hold of my doctor to talk about a medication or a concern that I have and getting passed back and forth to 5 different people in the office, from the front office person to the medical assistant to the nurse, before it finally gets to the doctor to answer my simple question. And now days to a week have gone by.
So we're cutting all of that out and giving patients direct access to us. And that is what the premise of direct primary care is, to actually focus on relationship and time with patients. All right, so you might think monthly membership and you might think
Concierge.
Right, so how are we different from Concierge?
Well, probably the biggest thing is the cost. For, as you said, as little as $109 a month. That includes everything that we just talked about. Whereas Concierge tends to be a lot more expensive. Another big difference is we don't bill insurance at all. So all those hidden fees that may come up with co-pays, deductibles that haven't been met yet, you don't have to worry about any of that with us. The membership is the membership, and that's all that there is to it. The other thing is the contract. We don't make you sign up for a year and then 2 months into it decide that you don't like us anymore. We want you to choose us. So we ask that you give us 3 months to kind of establish that relationship with you, but then it's month to month after that.
So no annual contract?
Yes, no annual contract.
Well, that's it for today. And again, stay positive, stay healthy, and we'll see you next time.
Bye.
Bye.